you so much, Speedy, for that. That's quite intense information. And at least in Kenya, we have policies and these conversations are happening. I wrote a piece on generational gap and how Gen Zs don't know how to communicate with millennials. Millennials don't know how to communicate with their parents. There's a generational gap, and it all boils down to the fact that we're not having conversations. And I like the fact that definition of terms is something that's really kind of throws everything off discussions. How do you define your mental health? How do you say I have your mental health and well-being is intact? What does that mental health aspect even actually mean? And I know Gideon started with that at the beginning, and we need to create enough awareness so that we're on the same page. But I know we've been talking on a kind of generalized scientific systems sort of a discussion. And as I began the discussion in the beginning, we said we're taking it back to make it more Afrocentric. And we're looking at it from the African perspective and lenses. Let's take that conversation back home. Let's bring it back to where individuals can actually understand. We are super excited to be having the founder and president of the East African Community Mental Health Network, Masemo, also kind of giving his input. And we really do feel for DRC Congo going through the Ebola crisis right now. And you can imagine with the limited access to care, he's just left his chat there. DRC remains, when it comes to mental health, remains severely underfunded. And this is something that we can resonate with. I mean, note a lot of African countries have hit their Abuja declaration target of at least 15% of government budget, country budgets need to be redirected to health. So you can see if they can't reach at least 15%, getting money for mental health might be an afterthought.